Dr. Bob Christopher's role to this village was chief recruiter. Past president in 1987, he reminded members of the multidisciplinary nature of the treatment of cerebral palsy and that each member had the job of bringing friends and colleagues from outside their field in. He hasn't forgotten that message, and he reminds us of the uniqueness of this academy.
Well, 1955 was the end of my first year of medical school, and I was home in the summer and contracted poliomyelitis. It was, a matter of fact, only about 3 months before the polio vaccine came on the market. I was one of the last. I was placed in the city hospital in Cleveland, and my doctor was Dr. Nadine Coyne, who was a specialist in physical medicine and rehabilitation. And I'd been there only a few weeks, maybe 6 weeks, and she came into my hospital room and she said, you're getting physical therapy every day and you're really making good progress. But she said, you know, physical therapy is exercising your body. We have to exercise your brain. And she said, I have student nurses coming from Western Reserve University, and I would like you to give lectures, 3 lectures on motor nerve function and how the spinal cord and brain connect with the muscles and make them work. And my immediate reaction was, I said, I've only finished 1 year of medical school. She said, yeah, but you've been taking physiology. And I said, yeah, we completed the physiology course the end of the freshman year. She said, I'll help you. I'll be in the lecture room. And she said, but I want you to make up these lectures. And she said, here's some books to help you. And so I did that. And then after that, she'd come in every morning and we would make rounds together on the polio ward, where we had many patients, some respiratory patients and some not. And she began talking to me about the specialty of physical medicine. She said, you would be perfect, because she said, when you're dealing with the patients, you can truly say, when they have complaints, I know where you're coming from, because I've been through that too. And she said, that makes a lot of difference with patients, to know that they're talking to somebody who's had personal experience with the same problems. And I said, gee, I never thought about that. And the more I thought about it, the more it made sense. And I did want a specialty that was dealing with patients, because I had been thinking about some that don't directly deal a lot with patients, like radiology or pathology. And then decided, gee, no, I want to deal with patients who I can talk to, not those who are dead. And so it was a perfect fit. And she told me that, she said, St. Louis U, she said, you know Ottokar Maychek? And I said, no, I never heard the name before. She said, well, he's at your medical school. He's the head of physical medicine there. And she said, you need to talk to Dr. Maychek when you get back to St. Louis. I said, well, that's assuming they will take me back after the fact that I'm in a different situation now. I don't have the use of my legs like I did. I said, she said, but you're doing well walking on crutches with braces. And she said, I don't think that would be an impediment to getting back in medical school. And she was right. But she was my first influence, and she got me to thinking that way. Now, during my freshman year in medical school, I had kind of leaned towards musculoskeletal medicine. I was thinking orthopedic surgery or neurology as a specialty. So this was the closest to those specialties that you can get, because we work a lot with patients who have seen neurologists and orthopedic surgeons. And so it not only made sense to go into a field like this, but it was related to my original interests during my first year of medical school.
Who have been your most cherished friends within the academy?
Well, there's many. I first think of Elliot O'Reilly. Dr. O'Reilly, as a matter of fact, was chairman of orthopedic surgery at St. Louis University. I would not have met him until the junior year when they gave us some lectures on orthopedic surgery, and I did. But he didn't remember me when I came to the Academy for Cerebral Palsy. I actually joined in, I think it was 1981, at the suggestion of Dr. Bender, because Dr. Bender was a member, and then eventually he became president. And Dr. O'Reilly also is a past president of the CP Academy. And but at the time that we got to know each other well was when he was the historian and served on the board. And I was asked to serve on the board as it was called an at-large member. You weren't representing any particular organization. And I said, he said, well, I'm glad to know you. I said, well, I've met you before. He said, you have? I said, I was a student at St. Louis University when you were the chairman of orthopedics. And he said, I don't remember that. I don't remember you. And I said, no, you probably wouldn't, because I was just in a whole bunch of freshmen and so forth. And then I said, after I had polio, I said, I was sent up to orthopedics to be examined to see if I could come back to med school, but I didn't see you. I saw Bob O'Brien. And he said, yeah, he was my vice chairman of orthopedics. And I said, it just happened to be he was the one that was on call that day and took me. And so I said, I was just one of those many faces you lectured to at St. Louis U. And we became very close friends after that. And a year later, he said to me, pretty soon I'm going to be retiring and leaving this job as historian. And he said, I want you to come on the board as my assistant historian, and so that you can learn the job and what the historian does and so forth. And so we were, every board meeting, and there are 3 board meetings a year, we were sitting side by side and working with him.
And it's my understanding he had been the historian since its inception. Is that
Yes,
correct?
that's right. Yeah.
Wow.
When they first realized the need for a historian, because the biggest part of the historian's job was keeping up with motions that were passed by the board, because sometimes the board would pass a motion that had been passed 2 or 3 years ago, but they didn't know it because they were new on the board. And so I had the minutes from all of the board meetings going back to the beginning, to 1948.
Wow.
And I could consult those when I was in the board meetings, and sometimes just put my hand up and say, we took care of that 3 years ago, so you don't have to do that. You're already empowered to do those things. And the board seemed to feel that this was a very important role, that this was something that they needed to keep doing, because they don't want to just reinvent the wheel, you might say. And so then a couple of years later, Elliot O'Reilly retired, and then I took over as the historian until 2001, when we moved from Memphis to Florida. And I thought it would be better to turn it over to somebody who was a little younger.
How about Dr. Alexander? I know that you were very close with him as well.
Yeah, Mike and I knew each other through the Academy of Physical Medicine and Rehabilitation. And we met at one of the annual meetings, and he was in a wheelchair. And I asked him why, and he said polio, and I said, me too. And after that, we decided that every year when we had the annual convention, we would go out to lunch together or go out to dinner if our wives were with us, and which we kept up as kind of a tradition for more than 10 years.
Yeah.
And then we'd be on the phone back and forth between each other several times a year. And I still consider him a close friend.
You became president of the Academy in 1987. Can you tell me a little bit about that meeting and what were the highlights?
Yeah. Well, first of all, the meeting that year when I was president was held in a great venue. We were in California, right across from Disney World. We stayed at the Hilton, and that was our headquarters hotel.
Fun.
People could walk across the street into Disney World. Well, that one they called Disneyland out there. And so as a result of where it was located, it was the largest one we had had up to that date.
Neat.
We had great attendance because people could bring their kids and their wives and all of that, and they could have a great time while everybody else was in the meeting.
Well, I remember that you've told me that the topic of the meeting was treating the whole person.
That's right. That was the idea, that treating the whole person, that we can't just treat their disability. We have to treat how that affects the functioning of the rest of their body and how it affects their relationships with their family and other people and so forth. And I got several speakers talk at the different sessions on that very topic. You know, they were called the role of rehab medicine in orthopedics, the role of rehab medicine in neurology.
Neat.
You know, the role of rehab medicine in psychiatry, which many people never thought of. But our occupational therapists oftentimes worked with mental health patients.
Absolutely.
And, we were responsible for the training of the occupational therapists from the medical side of things.
Yeah, it sounds like the academy meeting, because it's a multidisciplinary academy, would be a perfect place to have that kind of opportunity.
Well, because we did have members of the academy who are from all those specialties.
Absolutely. Yeah.
And we even had one on the role of rehab and general practice. Because those, God bless them, those general practitioners, they take people with all kinds of different problems, and they do need specialty consultation quite often.
Yeah.
So it was well received. The feedback we got from people after going to the meeting was very positive. They thought it gave them a lot to think about, and that they would look more towards treating the whole person than just their disability.
Exactly. How do you think the field has changed, for better or for worse?
Well, of course, it's the biggest way in which it has changed is the recognition of the importance of rehab medicine in this total picture of these disability diseases. When I joined the specialty in the 60s, it was every time I would introduce myself to a new patient, I'd have to explain who I was and what I did. And a lot of times they said, well, you're just a doctor who practices physical therapy. And I said, no, that's not that at all. I said, I train therapists in the medical aspects of their specialty, but I said, I'm not a physical therapist. I don't do exercises. I have people working with me who do that. And as time went on, I had less and less need to explain because people said, oh, I know what physical medicine is. And so more recognition of the role of physical medicine in cerebral palsy management and other similar diseases. But, even today in 2021, there are still a lot of people who don't understand our specialty, unless they've had somebody in their family that went through rehab. Then they do, and they're usually converts. I mean, they not only know about our specialty, but they're enthusiastic about
Sold. Absolutely.
both from the standpoint of what we do and the standpoint of the fact that we are holistic doctors who try to treat the whole person.
And over the lifespan.
And yes, from cradle to grave.
Absolutely.
That's one of our philosophies.
So do you have advice for current members of the Academy?
What I would advise the Academy was to continue what they have been doing to broaden their membership. That not only orthopedic surgeons and neurologists would have interest, and we have a good number of pediatricians in the Academy. But I think family practitioners and people in other fields would greatly benefit, whether they see children or if they're only even if they're only seeing adults. There's a lot in there that would be of help to them. But I think particularly the family practitioners, I think if they have a large pediatric load, they're going to have a number of disabilities. And it would benefit them to, even if they don't join the Academy, at least come to the meetings. And so I think doubling the efforts towards other specialties would be would be a boon to the Academy, but it also would be to general medical practice.
How do you want to be remembered?
Well, I suppose as oftentimes people, you don't think about things like that, but I guess I'd like to be remembered as one of the guys who did his best during his presidency to expand the membership and to involve more both medical, nursing, and allied health people in the field. And I thought we were fairly successful that year.
So what gives you hope?
I think what gives me the most hope now is the fact that the concept of holistic medicine is being embraced by more and more people in various specialties. We have a lot more orthopedic surgeons today who now are not just looking at the broken bone, but they're looking at how that affects that person, their relation with their family, their job, and so forth. And you can tell from reading the journals, and I still try to keep up with a number of them, that they're looking at their patients with much more of a holistic philosophy than ever before. And I think that's going to continue to grow because the patients are demanding it.
And do you have anything to add?
I think the one thing I would say is that when the Academy moved its headquarters to Milwaukee, we were all kind of a little frightened and concerned that this wouldn't work out. But I think the group there has been so supportive, so helpful in so many ways. It just kind of saying to all of us, you just tell us what you need, we'll get it done. And they have come through. They've done a wonderful job. And I would just say to the Academy, don't change your management company because you got one of the best ones in the country. And every little thing that you mentioned to them, that some convenience during the meeting or stuff like that, they would make sure that it gets done. I kudos to them. I just cannot say enough in support of this group, this management group. I think they're just doing a great job. And I want the Academy to stay with them. And to the people that are new in the Academy, you've joined a great group and you will get more out of it than you put into it. I felt that I did.